Uganda will receive its first batch of COVID-19 vaccines on Friday. The doses will first be given to health workers, security personnel, teachers, persons aged 50 and above, persons with underlying health issues and other emerging high-risk essential groups. However, according to a meeting held by different stakeholders on access to medicine in the face of COVID-19, there are concerns about how this vaccine will reach the intended recipients.
The vaccines are few, everyone wants to access, everyone needs their life to be protected, but it's entirely up to the government to be able to say these are the rules and these are the rules that we are going to be following.
Mulumba also adds that the ministry's guideline for using the national ID for one to get the vaccine may not be effective and there may be cases of drug theft.
The issue that has always happened is people make shortcuts. We need to also hear strategies on how these shortcuts are going to be bridged, because we have already been watching stories where people are reporting that some people have access to vaccines before others.
In the long run, Mulumba says that getting vaccines from abroad is very expensive and it is about time Uganda focused more on promoting local pharmaceutical manufacturers.
You also know that when the Chinese government made a visit here, one of the offers they gave was for the vaccines to bring in about 300,000 doses of the vaccine. So vaccines are now being used as part of diplomacy. One of the things that we need to think about is promoting local pharmaceutical manufacturing. If we do not promote local pharmaceutical manufacturing as a country, it's not going to be sustainable to always wait.
For Jen Seruwaji, the Executive Director of CRT Uganda, the World Health Organization should work towards making it possible for as many companies as possible to produce vaccines.
When patents are waived, the cost of drugs come down. Because when you look at the cost of HIV drugs, when they had just been manufactured under patents, they were very, very expensive. Almost $10,000 a dose, but now they came down to manage it. So this is what we are also asking the world community, the big pharmaceutical companies, they waive the patents so that these vaccines can be produced massively on a massive scale.
The Ministry of Health today confirmed that vaccination for the first phase will start on the 10th of March. The ministry will then roll out the vaccination program for age groups between 18 to 50 years in a staggered manner in phase 2 and 3 of the COVID-19 vaccination campaign. Sandra Twinovdio, NTV News.